So, what are the signs and symptoms of myelofibrosis, and really what can people expect as they live with this condition?
Yeah. One of the most frustrating things about myelofibrosis is that the signs and symptoms are very non-specific, meaning many other medical conditions can cause those signs and symptoms. Um, Very common ones can be fatigue, particularly in patients who have anemia or a low hemoglobin. Some patients will have drenching night sweats. Others can kind of feel achy all over. For patients who have developed a large spleen, those patients can have abdominal bloating. Sometimes they can even have abdominal pain. They can have weight loss because they aren't feeling as hungry as they would otherwise. So those are, and sometimes patients can kind of have just vague, not poor, poorly described bony pain that's just kind of all over.
Mhm.
And again, I think the hard thing is many different medical conditions can cause those symptoms, but when you add those symptoms together, when you see blood work that's concerning for an MPN, when patients maybe have an enlarged spleen, all of those things kind of start to kind of build a story of I'm worried about my patient having a MPN, and now I need to do further investigation to definitively say, do they have this disease or not?
Excellent. And can you tell us really the importance of patients tracking their symptoms to when they come and have those conversations with you in your office? Why is it so important that they are tracking those symptoms kind of time over time?
I think I'm going to look at it two ways. So the first is patients who are in what we call active surveillance, meaning we have not started any specific medicines for their myelofibrosis, but we're keeping a very close eye on things. And sometimes when symptoms start to ramp up, that might even be a insight into the disease beginning to progress before blood counts or other kind of laboratory tests kind of give us that inkling. So an increase in symptoms, weight loss, those sorts of things may tell us, well, I may need to think about, for example, doing a bone marrow biopsy, even if blood counts may not otherwise kind of tell me to do that, to get a sense of is the myelofibrosis progressing or are one of these other MPNs progressing towards myelofibrosis? Now, the other bucket is patients that are on treatment for their myelofibrosis. So, in this day and age, our approved medications for myelofibrosis predominantly focus on shrinking down the spleen size and making patients feel better in terms of their symptom burden. So, with that in mind, oftentimes our gauge for is the treatment I'm using working is our patients feeling better? And sometimes it can be a very general, set of questions that can help someone kind of say that yes, over the last several weeks, overall my energy's better. I'm maybe eating a little better. These night sweats are gone. But for other patients, sometimes it can be very helpful to have a more objective way of doing that. So there's a variety of what we call symptom assessment forms that have been developed for patients with myeloproliferative neoplasm. Some patients find it very helpful to actually, objectively fill out those forms and really put a number to the symptoms that they're having and if they're getting better or not.